Greetings, everyone. Welcome to CAP's Safety's Health and Wellness Briefing on Hypertension. During this briefing, you will obtain the basic knowledge for detecting, evaluating, and the treatment of hypertension. After reviewing this presentation, you should be able to understand what hypertension is, the causes, the symptoms, and the treatment. First, let's go over some definitions for you to have a better idea of what hypertension is. Blood pressure is when your heart contracts. It causes a wave in the blood system of the body. This can be seen when an artery is cut and the blood spurts out of the cut vessel with each beat of the heart. Measuring blood pressure is usually done by putting a cuff around the upper arm and inflating the cuff with air. Once the air pressure in the cuff exceeds the pressure in the artery below the cuff, the flow of blood beyond the cuff stops. As the air pressure is slowly lowered, there comes a point at which the blood begins to flow through the artery again. This is the systolic pressure. That can be heard or felt over the artery below the cuff. In between beats, the artery closes and the blood flow stops again. As the pressure is lowered further, a point is reached at which the artery stops closing between heartbeats. This is called the diastolic pressure. Blood pressure is usually measured in terms of millimeters of mercury. Hypertension is an excessively high pressure within the blood vessels of our bodies, or abnormal high blood pressure. It is usually described by two numbers, the systolic pressure and the diastolic pressure. As an example, this is usually written as, say, 140 over 90 millimeters of mercury and etc., which is your systolic pressure reading over your diastolic pressure reading. Systolic is the peak pressure reached in the blood vessel during each contraction of the heart and is the first and highest number written. Diastolic is the lowest pressure in the system that occurs when the heart relaxes between contractions and is the second and lower number when written. A normal systolic pressure is usually between 90 and 140 millimeters of mercury. An ideal level for an adult is about 120 millimeters of mercury. A normal diastolic pressure is usually between 60 and 90 millimeters of mercury, and an ideal level for an adult would be 70 to 80 millimeters of mercury. Our blood pressure is a highly variable factor and can fluctuate quite widely over just a short period of time. This is an important aspect of how our circulatory system works, allowing the body to respond quickly to emergencies, such as the fight or flight condition, and then relax back to a resting state when the danger passes. Let's continue with a few more definitions. We have discussed what hypertension is. It is also known as high blood pressure. Pre-hypertension is a systolic pressure between 130 and 140 millimeters of mercury. Stage 1 hypertension is a systolic pressure between 160 and 180 millimeters of mercury. Stage 2 hypertension is a systolic pressure greater than 180 millimeters of mercury. Sustained hypertension with systolic pressures exceeding 140 millimeters of mercury for long periods of time can cause damage to blood vessels through shear forces on the walls of the vessels. Hypotension is the opposite of hypertension. It is abnormally low blood pressure, and this can cause shock, which is a condition where the blood pressure is abnormally low and the body is beginning to shut down. This is life-threatening. There are two types of hypertension, primary and secondary. Primary hypertension, for most adults, there is no identifiable cause and tends to develop gradually over many years. Secondary hypertension. It's caused by an underlying condition which tends to appear suddenly and cause higher blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, including sleep apnea, kidney problems, adrenal gland tumors, thyroid problems, certain defects you're born with in the blood vessels, certain medications such as over-the-counter pain relievers and some prescription drugs, illegal drugs such as cocaine and amphetamines, and also diabetes. High blood pressure also has many risk factors, including your age. Until about age 64, high blood pressure is more common in men, but becomes common in women after age 65. Your race. It's most common among people of African heritage. Your family history. Being overweight and not being physically active. Using tobacco or too much sodium in your diet. Also, not enough potassium in your diet can accumulate too much sodium in your blood. Another risk factor is drinking too much alcohol, high levels of stress, and sometimes pregnancy. High blood pressure is most common in adults, but children may be at risk also. Now, let's discuss complications of hypertension. The excessive pressure on your arterial walls caused by high blood pressure can damage your blood vessels as well as organs in your body. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. Some of the complications include heart attack, stroke, or other health problems. Aneurysms. Increased blood pressure can cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, this can be life-threatening. Another complication is heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to thicken. Eventually, the thickened muscle may have a hard time pumping enough blood to meet your body's needs, which can lead to heart failure. Another complication is weakened and narrow blood vessels in your kidneys. This can prevent these organs from functioning normally. Another condition, thickened, narrowed, or torn blood vessels in the eyes, resulting in vision loss. Another condition is called metabolic syndrome. It is a cluster of disorders of your body's metabolism, including increased waist circumference, high triglycerides, low high-density lipoprotein cholesterol, or HDL, the good cholesterol, high blood pressure, and high insulin levels. Another condition is trouble with memory or understanding. This may affect your ability to think, remember, and learn. We will now cover the recognition and identification of hypertension. For many decades, hypertension has been considered a silent killer. That's because there are so few symptoms that indicate the presence of hypertension. The only way to effectively recognize the development of hypertension is through regular screening. This usually involves having one's blood pressure checked at home, at a pharmacy, or a medical office. Home blood pressure monitoring has several advantages and often is a more accurate indication of one's day-to-day blood pressure. How do you prevent and treat hypertension? Hypertension can often be prevented and treated through lifestyle activities such as maintaining a healthy weight, a low-sodium diet, regular exercise, and relaxation training with daily use of relaxation exercise has been shown to significantly lower blood pressure. Once hypertension has been diagnosed, it becomes even more important to monitor one's own blood pressure on a regular basis and continue both lifestyle activities and appropriate medication to keep the blood pressure in a healthy range. Aiming for a systolic pressure under 140 millimeters of mercury is a good goal. For those with diabetes, prior heart attack or stroke, or coronary artery disease, the recommended maximum pressure is often below 130 millimeters of mercury. It is important to follow a physician's guidance when managing hypertension. Lastly, when lifestyle modification is not sufficient to keep the blood pressure in a healthy range, medications may be necessary. If you've been diagnosed with hypertension, there are many categories of medications that a physician can prescribe, including diuretics or fluid pills. These reduce the blood volume through their effects on the kidneys. ACE inhibitors. These also work through the kidneys to influence an important hormonal system. Beta blockers. These medications work primarily on the heart to reduce the strength of the heart contractions and slow the rate of contractions. Calcium channel blockers. These medications slow down the heart contractions. Thank you for reviewing this presentation. Remember to take the quiz on Access to receive monthly safety education credit. This briefing is also located on our Safety Briefings webpage located at gocivilairpatrol.com.